This medication is used to treat high blood pressure, which can help prevent strokes, heart attacks, and kidney problems. It contains two medications, Trandolapril and Verapamil. Trandolapril is an ACE inhibitor, while Verapamil is a calcium channel blocker. They both work by relaxing blood vessels, making it easier for blood to flow. Verapamil may also lower your heart rate. It's important to take this medication as directed by your doctor and at the same time each day to get the maximum benefit. Make sure to read the patient information leaflet before starting this medication and each time you refill it. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth with food as directed by your doctor, usually once or twice daily. Swallow the tablets whole and do not crush or chew them. This can release all of the drug at once, increasing the risk of side effects. The dosage is based on your medical condition and response to treatment. Take this medication regularly to get the most benefit from it. To help you remember, take it at the same times each day. Keep taking this medication even if you feel well. Most people with high blood pressure do not feel sick. Do not stop taking this medication without consulting your doctor. Some conditions may become worse when this drug is suddenly stopped. Your dose may need to be gradually decreased. It may take up to several weeks before you get the full benefit of this medication. Tell your doctor if your condition does not get better or if it gets worse, your blood pressure readings remain high or increase. As your body adjusts to the medication, you may experience dizziness, lightheadedness, tiredness, dry cough, constipation, or nausea. If any of these effects persist or worsen, notify your doctor or pharmacist immediately. To reduce the risk of dizziness and lightheadedness, rise slowly from a sitting or lying position. It's important to remember that this medication has been prescribed because your doctor has determined that the benefits outweigh the potential side effects. Many people using this medication do not experience serious side effects. Contact your doctor immediately if you experience any serious side effects, such as fainting, new or worsening symptoms of heart failure, signs of high potassium blood level, or signs of kidney problems. Rarely, this drug may cause serious liver disease. Seek medical help if you experience symptoms of liver damage, such as persistent nausea or vomiting, loss of appetite, abdominal pain, yellowing of the eyes or skin, or dark urine. While a serious allergic reaction to this drug is rare, seek medical help if you notice symptoms such as rash, itching, swelling, severe dizziness, or difficulty breathing. This is not a complete list of possible side effects. If you notice any other effects, contact your doctor or pharmacist. Trandolapril-Verapamil Air is a combination of two medications, Trandolapril and Verapamil. Trandolapril is an ACE inhibitor and Verapamil is a calcium channel blocker. This combination medication is used to treat high blood pressure. It works by relaxing blood vessels so that blood can flow more easily. This medication is usually taken once a day with food. The best time to take it is at the same time each day to help you remember. It is important to prevent pregnancy while taking this medication, so consult your doctor for more details and to discuss the use of reliable forms of birth control while taking this product. If you are planning pregnancy, become pregnant, or think you may be pregnant, tell your doctor right away. Before taking Trandolapril-Verapamil Air, make sure to inform your doctor or pharmacist if you are allergic to Trandolapril, Verapamil, or other ACE inhibitors. This medication may contain inactive ingredients that can cause allergic reactions, so it's important to discuss any potential allergies with your pharmacist. It's also crucial to discuss your medical history with your doctor or pharmacist, especially if you have certain heart rhythm problems, heart issues, muscle/nerve disorders, a history of allergic reactions, or any other health conditions. Additionally, be sure to inform your healthcare provider if you are using alcohol, marijuana, or if you experience excessive sweating, diarrhea, or vomiting, as these factors can affect the effectiveness of the medication. This medication may also increase your potassium levels, so it's important to consult your doctor or pharmacist before using potassium supplements or salt substitutes. It's also essential to inform your doctor or dentist about all the products you use before undergoing any surgical procedures. If you are pregnant, planning to become pregnant, or breastfeeding, be sure to discuss the risks and benefits of this medication with your healthcare provider. Additionally, older adults may be more sensitive to the side effects of this drug, so it's important to monitor for any potential symptoms and inform your doctor as necessary. It's important to be aware of potential drug interactions with Trandolapril-Verapamil air, as they could affect how your medications work or increase your risk for serious side effects. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Trandolapril-Verapamil air include aliskiren, clonidine, disopyramide, and certain drugs that weaken the immune system. Other medications can affect the removal of verapamil from your body, which may affect how this product works. Verapamil can also slow down the removal of other medications from your body, which may affect how they work. Additionally, some products have ingredients that could raise your heart rate or blood pressure, so be sure to inform your pharmacist of all the products you are using and ask how to use them safely. If you are getting injections for bee/wasp sting allergy, desensitization, and are also taking Trandolapril-Verapamil air, it's important to make sure all your doctors know which medicines you are using. If someone takes too much Trandolapril-Verapamil air and has serious symptoms like fainting or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. Symptoms of an overdose may include severe dizziness, fainting, and a very slow heartbeat. If you are in the US, you can call your local poison control center at 1-800-222-1222, and if you are in Canada, you can call a provincial poison control center. Remember, it's important not to share this medication with others. In addition to taking this medication, making lifestyle changes like exercising, quitting smoking, and following a low cholesterol/low fat diet can help it work better. Talk to your doctor for more information. While you're taking this medication, you may need to have certain lab and/or medical tests done to monitor things like kidney function, potassium levels, and liver function. Be sure to attend all of your medical and lab appointments and talk to your doctor for more details. It's also a good idea to regularly check your blood pressure and heart rate while taking this medication. Your doctor can show you how to do this at home and you can share the results with them. If you forget to take a dose, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one. Take your next dose at the usual time. Don't take double the dose to make up for the missed one. It's important to store Trandolapril-Verapamil air at room temperature, away from light and moisture. Make sure to keep it out of the bathroom and away from children and pets. When it comes to getting rid of any unused medication, it's best to consult your pharmacist or local waste disposal company for proper disposal methods. And remember, never flush medications down the toilet or pour them into a drain unless instructed to do so. It's always best to properly discard this product and it is expired or no longer needed. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.